You arrive on scene and there's a 24-year-old woman on the floor.
Okay. PP is on. Is my scene safe?
Yes, it is.
Okay. Is this my only patient?
Yes, it is.
Okay. Can you tell me the mechanism of injury?
She fell on her back.
Okay. So she fell on her back. I'm gonna request additional life support, advanced life support, and then I'm going to have my partner. Normally I would have my partner hold C-spine, but I'm just gonna verbalize it for now. And then I'm going to go. I'm gonna ask for my general impression.
A 24-year-old woman fell off a ladder and is complaining about back pain.
Okay, now I'm going to determine her level of consciousness by talking to her and introducing myself. So, hi, my name is Francisco. I'm with AMR. Can you tell me your name, please?
Maya.
Maya. What day is it?
Sunday.
Sunday. And can you tell me where you are?
Home.
You're at home. And what happened before I arrived?
I was putting my lights up and I fell.
You're putting your lights up and then you fell. Okay. So just by her talking to me, I can tell that her airway's open. Would you say that's your chief complaint, that your back hurts?
Yes.
Okay. And so now that her airway's patent, I don't see a need for an OPA or an NPA. I'm gonna ask for her breathing now. Is she ventilating adequately?
Yes, her breathing is adequate.
Okay. So I don't see a need for oxygen therapy right now, and there's no injury or anything constricting her breathing or ventilation.
No, there's not.
No. Okay. So now I'm gonna go down to circulation, and I'm gonna ask for the pulse rate, rhythm, and quality.
Her pulse is 96 and it's regular strong.
Thank you. And then skin signs.
Warm, dry, and normal?
Okay. And is there any major bleeding?
No, there's not.
No. Okay. So I'm going to I don't see a need to initiate shock management right now. And so I'm gonna call this patient a code 2 because I don't see any life-threatening injuries. So now I'm gonna go down to my history taking, and I'm gonna get some baseline vitals. So what's the blood pressure, pulse, and respiratory rate?
Her blood pressure is 120/80. Her pulse is 96. Respiratory rate is 16 breaths per minute.
Okay, thank you. And then I'm gonna do my sample now, my sample history. So Maya, can you please tell me, do you have any allergies?
No.
No allergies? Do you take any medications?
No.
No? And then do you have a past medical history I should know about?
No.
No? What was the last thing you ate or drank?
I had some noodles and water.
You had some noodles and water? Okay.
Yes.
And then what else happened before you fell?
Putting my lights up.
You're putting your lights up, okay, thank you. And now that I have my sample, I'm gonna go ahead and check for decaf BTLS. I'm gonna do my head to toe inspection of my patient, and I'm gonna be checking for deformities, contusions, abrasions, puncture wounds or penetrations, burns, tenderness, lacerations, or swelling. And so I'm gonna go to her scalp and I'm gonna palpate it and inspect for any decaf BTLS. I'm gonna check the back of, I'm gonna check my gloves for any bleeding, and then I'm gonna check her ears for any sort of bleeding, bruising, or clear liquid coming out. Then I'm gonna assess her forehead, her eyes, her mouth, her nose, looking for decaf BTLS, her face, and then I'm gonna move down to the neck, and I'm gonna look for decaf BTLS. So I'm gonna look at the trachea. I'm gonna look at the jugular veins. I'm gonna look for a jugular vein distension, and then I'm gonna check her cervical spine, looking for decaf BTLS. From there, I'm gonna move on to her chest. I'm gonna look for decaf BTLS. I'm gonna check her and palpate her clavicles. Make sure that she doesn't have any decaf BTLS. I'm gonna listen for lung sounds. And lung sounds are clear, right? Okay. And I'm gonna check her abdomen and her pelvis. I'm gonna palpate the 4 quadrants. And then I'm going to check her pelvis for any decaf BTLS. Okay. And then I'm gonna go into her lower extremities, and I'm gonna look for decaf BTLS. I'm gonna check both of her legs at the same time. And then I'm gonna check individual legs, looking for decaf BTLS. I'm gonna go down to her feet. I'm gonna check the CSM. So I'm gonna check her pulse. It seems normal. Do you know what toe I'm touching?
My big toe.
Big toe, okay. And then can you push down for me? Can you push up? Thank you. I'm gonna check this other pulse. Seems to be the same. Do you know what toe I'm touching?
My big toe.
Okay, can you push down? Push up. Thank you. I'm gonna go to her upper extremities, so her arms. I'm gonna look for decap BTLS. I'm gonna check for CSM, so I'm gonna check her pulse, which appears to be normal. And then I'm gonna ask her, do you know what finger I'm touching?
My ring finger?
Good job, thank you. Oh, then can you push up for me, please? Okay, push down. Thank you. I'm gonna go around to her other arm. I'm gonna look for decap BTLS. I'm going to check her pulse. It appears to be normal too. You know what finger I'm touching?
My thumb?
Your thumb, good. And then can you push up for me? Thank you. Can you push down? Okay, now I'm gonna check her posterior thorax, lumbar, and buttocks area. Normally I would have my partner hold C-spine and then we would rotate her on their account, but since I'm just gonna verbalize it now since I don't have a partner. So I'm gonna carefully roll her towards me and I'm gonna look for decap BTLS. I'm gonna check the cervical one by one. I'm gonna check the thoracic spine. I'm gonna check the lumbar spine. Looking for decap BTLS, and I'm gonna check the buttocks area. And then I'm gonna roll her down gently on the count of C-spine. Okay, and now I'm gonna look for any secondary injuries. Are there any?
No, there's not.
There isn't. And then so now I'm gonna decide on when to reassess my patient. So since they're a low priority, a code 2, I'm gonna reassess my patient every 15 minutes until transportation arrives. That's it.